Thank you for joining me on Love Cooking with Toghfah. I share recipes and my cancer journey to raise cancer awareness. I also spread my positivity to cancer patients and non-cancer patients. I would like to request, if you haven't already, to please add me on my other social platforms that showcases different versions of myself, as well as on my cooking channel if you are new here. And guys, you are also now able to donate to my channel. You can do this via PayPal or go get funding on my Facebook. In today's video, I'll be talking about my chemotherapy treatment session and the side effects thereof. And at the end of this video, I'll be showing a short clip of the process of my hair loss and the bald spots on my head, as well as a short clip of one of the members at my oncology center who rang the bell. I've been for 2 chemotherapy sessions to date. I previously recorded my first session and I uploaded it onto YouTube. When I was chatting to people, I realized not many knew how chemotherapy treatment was given to cancer patients. And I decided it would be a brilliant idea for me to record the process so that you are aware of how chemotherapy is given to cancer patients. On the day that I got there, the nurse ran through all the side effects of the chemotherapy treatment that I will be receiving on my treatment plan. Just on a side note, I'd like to mention that when you tell a cancer patient hair fall isn't always going to happen, please note that your oncologist needs to tell you this. It's all depending on the chemotherapy treatment that you will be receiving. In my case, I am on 2 types of chemotherapy and one of them causes hair loss. So after running through the side effects with the nurse at the oncology center, I received an injection in my right arm, the upper right arm. The injection aids in nausea so that you don't throw, or that I didn't throw up the chemotherapy that was going to be pumped into my body. The injection also causes drowsiness. That's to help you sleep through somewhat of the duration of the chemotherapy session. The chemotherapy was given to me through my veins the first time around, and this was very, very painful for me. This was so painful for me that at one point I was moaning of excruciating pain. Basically, the way it felt was, dry ice. So dry ice, when you touch it, it sticks to you. The chemo flowing through my veins felt as if my veins were sticking to my tissue, and I could feel it all the way, going into my body, and then it would feel as if my organs were sticking to each other. It was extremely painful. The pain of the chemotherapy was so hectic for me that the injection that causes drowsiness didn't work because the pain kept me awake. The nurses at the I keep stuttering when I say oncology center. So the nurses at the oncology center decided that it would be best if my doctor arranged for them to insert a chemo port. So basically, it is a cut and it's got a little bit of looks like a tube, kind of a flat surface. And they insert the drip into my chemo port, and that is how I will be receiving chemotherapy from now onward. My second session of chemotherapy was given to me through the port. I can now say that that was the best decision ever. So the second session, the second chemotherapy treatment session that I attended, it was given to me through the port. This was so fantastic because after I received the injection, I was able to get some shut-eye while 10 sachets were pumped into my system. When I got to the oncology center, the second session around, or the second time around, they sent me for a scan to see that the port was correctly inserted and there were no leaks, because they injected contrast into my port just to check on the x-ray if there was any leakage inside of my body that wasn't going to my veins. And they also then put the drip in and did, if I'm not mistaken, it's called a backflow, to check if any pus was coming out, and that would have then indicated that I had an infection. Luckily for me, that was not the case. To get the port inserted, that was a one-day administration. It was basically me going to the hospital, them taking me to theatre and making me to sleep, and wham bam, thank you ma'am, the operation was done. The wham bam, thank you ma'am part sounded very scary after I said they make you to sleep. I just realized that. So there are many side effects of the chemotherapy on my treatment plan. Some of them already appeared 48 to 72 hours later after receiving the chemotherapy. Just 2 days after receiving my first chemotherapy treatment, I was then experiencing body aches. When I say body aches, it's joint pains, muscles I didn't even realize could pain. And it literally feels like a bus or a truck hit you, reversed, and then hit you again. That is how painful. I remember sitting on the couch with my legs stretched out, and I couldn't lift myself. I couldn't do anything. I just sat there and I was in so much pain. I get teary-eyed just thinking about it. It was so painful to a point that I couldn't stand in the shower or wash myself. I couldn't open my 1-year-old daughter's bottle. I had to sit on a bench in the shower and I would moan because of all the pain that I was feeling. Guys, you must remember when you watched my first video, there was 10 sachets that was being pumped into my system. Imagine the amount of pain. I am there for 6 hours every time I go for treatment. I am the only one left. Anyway, so back to, the pain that I was feeling, and what I've learned is that the hot shower helped soothe the aches and pains that I was feeling in my body. The other side effect that I also experienced the first time around was dryness in my mouth. I'm still experiencing that right now as I'm speaking to you. But yeah, so the side effect that I had the first time around as well is the dryness in the mouth, and also it's a kind of metallic or bloody taste at the back of my mouth. I am due, like I mentioned, I am due to go for my 3rd chemo treatment, and I've already developed ulcers on the side of my mouth, which is also on the top of my palate. And the nurses, the first time around, already explained to me how I can treat those ulcers. And after, this is the side effects that I've faced after my first chemotherapy treatment session. I also experienced hair loss. This actually happened so fast and so quickly. Within the first 2 to 3 weeks, my hair was all over the show. My hair was falling out as if it was going out of fashion. Seriously, I would run my hands through my hair and I would sit with ponytails of hair in my hand. And, there was no need for me to even pull on my hair. It would just come out of my scalp. And by the 3rd week, I already had bald patches. But stay tuned. Like I said, I will be adding a short clip in of how my hair was looking when my hair started falling out. I also want to make mention the emotional attachment to hair is unbelievable. Like, I remember I was crying at one point, not because of the fact that my hair was falling out. I was already aware and prepared. And not because I wasn't comfortable with being bald. I mentally prepared myself for that bit. But the fact that, the part that got to me the most was me losing something of my person. I have never ever seen my scalp. This is the first time, and you guys get to see it with me as well. The reason why we get so emotional when our hair starts falling out, it's because, well, for myself, it now cements that I have cancer. And this had me thinking about people that lose their finger, or, you know, when they have to chop off a limb. It is very, very hectic. I mean, mine was just hair, which is going to grow back. Keeping my fingers crossed that hopefully it does. If not, I'm rocking my bald head, taking it out for a spin. I'll be wearing a scarf, a beanie, or even a wig. There's so many options out there. Soon after the hair loss, I faced nausea. Guys, this was to a point that when you feel like throwing up after having chemotherapy, listen to me and listen to me well. It doesn't come with a warning. I remember one day I was walking from my room, and I exited the room and I walked towards the lounge and I just threw up out of the blue. And another side effect as well that showed up around the same time is drowsiness. I still experience the drowsiness. In fact, the drowsiness is getting worse and worse. The other day, I visited someone and I walked into the fridge and yeah, I am laughing about it now because I understand my journey, and you know, I am the one with stage 4 cancer. If I'm not going to laugh about it, I feel that I won't make it through. So I hope you guys understand that and possibly adapt that as well. But you know what, guys, at that point I was so weak. Like I said, I couldn't open a bottle, my daughter's bottle. I wasn't able to open her bottle. I wasn't able to wash myself. I wasn't able to do anything for me. And that is the first weeks after my first chemotherapy treatment session. Doing normal day-to-day activities became a big task for me. I wasn't even able to pick my daughter up and hold her while standing. And then after my second chemotherapy treatment session, I still had the muscle aches, the body pains, I still had the joint pains. It actually gets worse. And, you know, the other side effects that I mentioned, which is the hair loss and the dizziness, the dryness in the mouth, I'm still experiencing that, and I'm due for my third session soon. I'm also facing forgetfulness. It's not long-term things that I'm forgetting. So basically everything since my chemotherapy session treatment started, and it would be little things. I would have thought that I took the cool drink out of the fridge and I didn't. Or I would have thought that I rinsed out the coffee cup, but that wouldn't have been the case. there are some more side effects. Like I said, there is quite a bit of side effects, especially with the chemotherapy treatment that is on my plan, or the plan that I am on. And another side effect that I'd like to mention, I'm not too sure if you could see the little pigmentation dots on my scalp. It is quite sensitive when I touch my scalp. And I also have blueness in my fingers and toes, as well as bruising easily. I can literally just knock my leg into the corner of the counter and I would have a blue mark on my leg. In regards to the nerve endings in my fingers and toes that are not working in my favor, the feeling in my fingers and toes are 0 to none. But let me also mention that it's just the tip of the finger all the way to the end. So it's not the entire finger. It's just because when the chemo is pumped into your body, it flows in your system, but there is no outlet at the tip of your fingers and your toes, as well as your scalp. So when it pushes to that part of the body, there's no circulation. And that is the cause of the blueness as well as the pigmentation on my scalp. And it is so sensitive. It is extremely sensitive. Like, I can feel the numbness on my scalp. I can feel it feels like tingling in my fingers and my toes and on my scalp. I actually have pins and needles in my toes as I'm making this video, and that is also a side effect. But that doesn't just happen in my fingers and my toes, it happens in my entire body. I remember the first time it happened, it was very uncomfortable. You know, when you were a kid and you'd experience some pins and needles in your body and you'd tap on it and it would send a sensation all the way through your body? Well, it does not feel that good when you're receiving or when you are undergoing chemotherapy. I recall the first time I was laying in bed in the middle of the night and I had pins and needles, and it was so painful. Oh my God, it was so painful. I would just lay there in the middle of the night and experience the pins and needles, and this wasn't the best experience for me. So yeah. With my next session coming up, as mentioned, it will be on the 4th. I will be going for my third treatment, my third chemotherapy session, and after 2 weeks, they will be doing a scan to see if the chemotherapy is working for me and whether the cancer has spread. So guys, please stay tuned for an update on my cancer journey. So as promised, I'll be adding the clip of my hair loss as well as the part of the man that rang the bell. And thank you all so much for tuning in. I also want to send out my love to each and everyone that has supported me through my journey thus far. All the love you guys show me, all the praise you guys send through to me, it does the most for me in the times that I am at my lowest or in my darkest space. Last but not least, if you like my cooking or would like to share my links in regards to cancer awareness, please go ahead. I urge you to do so.
To all of you, to our co patients, and also the staff at large, sisters, the receptionist, Let me start with the receptionist. What a warm welcome I received from you. You are so welcoming me. You remember that when I arrived here, I was still like this. Even difficult for me to walk, but you comforted me a lot. Thank you very much for the receptionist treating me so nice in the morning and even when I leave home. So it makes me good. To my sisters, doctors, I'm speechless. I don't know what to say. You are so good to me. You are so good to me. You always come to me and ask, are you feeling okay? Are you alright? Like every time like that. I never been taken so care in my lifetime. And it was the first time to be in hospital of cancer. I nearly died. I stayed in hospital for 4 weeks in CIU. I was a stage 3. So there was time when I gave up. I said, God, everything is in your hands. You can take my life. So, but God refused to take my life.
Yeah.
So here am I now, going home, cancer-free. To my co-patients, I must say, my colleagues, there must be always hope. There's hope in life. If you believe in God, there's hope in life. I hope that you will survive like I've survived, as I told you.
Great stuff.
Dr. Parker told me that I was about to reach stage 4.
Yeah.
But for the will of God, said no,
Yeah.
you're not going to stage 4. Thank you very much. May God bless you. Thanks.
Thank you. Woo! So proud of you.